Welcome to the HIV podcast. Each week we focus on a person, historical event or pop culture moment linked to HIV and explore the story of what actually happened. I'm Sarah.
And I'm Jess, and between us we've been working in the field of HIV for 40 years. Our aim is to get as many people as possible HIV educated. Right, for the second time this morning, welcome to the HIV podcast. Fingers crossed for no feedback.
Oh, you're right.
Good, thank you. We thought we'd got all techie, didn't we, after last week's breakthrough with our headphones, but then today it's just, we've gone back to sound problems. Sod's law, Sarah, isn't it? It's just sound is not our bag.
No, it's not.
That's why we've got lovely Zoe.
Yes, but it sounds good so far, so let's plow on.
Okay, I like it. I have notes from last week.
Oh, from the HIV advert episode.
Yes, yeah. No feedback, as in no one, was super angry. I think people just took it as this is our opinions, which they were. That is.
Oh, did you think people would be angry then?
You know what it was? The advert was so divisive in itself between people either really loving it or really disliking it. I thought we might get feedback along those same lines. So I did have some people who obviously yeah, we agree. But I thought there might also be some people that were like, absolutely not. It's a masterpiece. But we didn't. And people just probably, I don't know why I think everyone's going to attack us all the time. Okay, if the sound has suddenly changed drastically, we should just know it's changed a bit. As we mentioned in the beginning, few sound problems. We're ditching the headphones. One episode in, we've ditched the headphones. Oh, just bonked my microphone. We'll come back to them another time. We don't have the time today to be working out why they're making weird hissing noises in Sarah's ears. I think it's mine. Who knows? Anyway, where were we? We were talking about the advert, weren't we?
Oh, yes.
Right, back in the room. Yeah, I think I just thought that. I don't know. But anyway, no, we didn't. But the notes aren't on that, Sarah. Someone quite rightly, Oliver Brown, thank you very much. We were talking about the Wizard of Oz and how I said that Oompa Loompas got ill because they were painted with lead paint, yeah? Nobody else noticed but Oliver Brown. There are no Oompa Loompas in the Wizard of Oz.
What are they then?
They're munchkins.
You're thinking of Charlie and the Chocolate Factory.
No, I'm not. So what I was genuinely talking about was the munchkins in the Wizard of Oz, but I forgot what they were called and did some weird crossover of Charlie and the Chocolate Factory and the Wizard of Oz. So I wasn't talking about the Oompa Loompas. I was talking about the munchkins.
Oh.
So apologies for my mistake there. We're talking munchkins. We're not talking Oompa Loompas.
So the munchkins were fine?
No, it's the munchkins. This is what I'm talking about. Allegedly, I'm sure is the story where I read where it was like lead paint that was mixed, or there was lead within their face paint that they had to wear.
So the Oompa Loompas were fine?
Yes, they've got nothing to do with anything.
Right, okay. So the munchkins in the Wizard of Oz all died of lead poisoning.
I didn't say they died, Sarah.
Oh.
I said some of them got ill, I think.
Oh.
Allegedly. I'm sure as I said, I'm sure I don't know if it's an urban myth or not. But yes, as Oliver Brown quite rightly pointed out, I was like, oh, how funny. Yeah, that is not what I meant at all. That's the only note I have from last week.
Oh, Oliver Brown's amazing. And I think I'd like him to be my new podcast partner. Just putting it out there.
I'm sure he wouldn't mind at all.
Yeah, I'm sure. Do you reckon?
Well, you're only good with sound.
He's very knowledgeable and he would keep us on track, I feel.
Well, if it was just you and him, he would definitely. He would be like, no nonsense. No silly nonsense over here, thank you.
Okay, well, thank you. That's very helpful to know. I hadn't even picked up on it.
Me neither. It's one of those things where you just go, yeah, okay, yeah. Even at the time, we didn't realise. Couldn't believe it. Anyway, what are we doing today?
This week and next week, we are going to look at ending transmission of HIV by 2030. I bang on about this all the time.
Yeah, well, I mean, everyone, not just you, everyone bangs on about this all the time, don't they, I feel?
Oh, but we've mentioned it a few times, haven't we, in previous episodes about, that's the aim is to end transmission. But we're going to look at what it actually is and whether it is achievable.
Yes.
So here in the UK, government announced on the 1st of December 2021 their National HIV Action Plan, having already committed to the global aim of ending transmission by 2030. So remember Matt Hancock?
Sadly, I do. He's in that SAS Who Dares Wins. And it was very good. They gave him what for they did, and I liked it.
Oh, okay. Well, he was health secretary at the time. He said he wanted the UK to be one of the first countries to reach the UN, United Nations, zero infections target by 2030. The action plan came about because of campaigning from HIV charities such as THT, National AIDS Trust, Elton John AIDS Foundation. I mean, it's not going to surprise you that I do have opinions on all of this, Jess.
Okay.
But these opinions are not aimed at these HIV charities because they have done phenomenal work to push the government forward. My criticism is, well, it's aimed at the government, really.
Okay, go on.
Well, we're going to look at what the plan entails and then how achievable it is for us as a local charity, because we can't speak for the rest of the country, but I do know that there are challenges for us in Berkshire and Hampshire. I know you'll have committed to memory the government's plan.
Oh, wasn't it to get to 0 new transmissions by 2030?
Yeah, amongst other things, yes.
Oh, okay.
So that is the overall goal.
Yeah.
And the government, they launched their plan and they said, we're doing this on the basis that the UK has a great track record for reducing HIV transmission already. A success story, they called it. Your solemn little face.
Oh, sorry. I was nodding. I was there like, the government plan.
So, yes, so they're saying we're already a success story. We can only get better.
Yeah.
So to clear up a few things, first of all, this is a global initiative. They didn't come up with this 2030 goal themselves, although when they launched it, that's how it came across to me. Right, the success story that they allude to is what I've got a few things to say about. But first of all, we'll look at what they base it on. So the government says there was a 35% reduction in new HIV diagnoses in England between 2014 and 2019. Pretty awesome, right?
Yes.
In 2019, an estimated 94% of people living with HIV had been diagnosed. Great, big tick there. 98% of those diagnosed were on treatment, and 97% had an undetectable viral load, meaning they can't pass the infection on.
They're not wrong. They do have a good track record there, don't they?
Yes, those are all fantastic statistics.
Yeah.
Right? And I don't want to be picky, but I don't think that the government should receive any credit for all the work being done, because that is down to the dedication and hard work of HIV medical professionals, HIV charities, and those living with HIV, all working together to ensure medication is accessible and taken regularly.
Yeah, I mean, that is true, yeah.
So that's my beef about that. Don't take the credit for our work, and especially don't take the credit for people living with HIV and their hard work in reaching those stats.
Well, yes, and there were, there's been lots of funding cuts, haven't there? We don't have any ring fence to money like we used to have. So you sort of, I suppose in some respects, the government have taken away from the HIV sector and then also gone, well, they're still working really hard and we're going to take all the praise for that work. I see what you're saying.
Yes. Now, the government says because of this success, well done, everybody involved in HIV care, they are committed to achieving 0 new HIV infections and HIV-related deaths in England by 2030. Fair enough. They said we will need to maintain the excellent progress made with key groups, gay and bisexual men, younger adults, and those in London.
Are they a different group altogether? I quite like the way they put that. Like they're just a totally different species of people, those in London.
That's so weird. I mean, London does have a high prevalence of HIV in some boroughs.
Yeah.
It's just the way they pick them out, those London people.
Yeah. You're a Londoner. You're in this. Like, how bizarre.
It's so weird. You completely put me off. Now I think of London as just kind of a separate entity.
Yes, for me, yeah. I quite like it's like a country by itself, isn't it now? Like,
yes.
London.
And the government want to significantly improve diagnosis for other groups. So more progress, they say, is needed on heterosexuals and Black Africans.
Okay.
They say they are the highest rates of HIV within that particular ethnic group. I mean, Africa's a massive country. They haven't broken it down into sub-Saharan Africa or the Horn of Africa, or it's just all of Africa and all of the African people.
It's a continent. I mean, it's enormous.
I know. So those groups will now be a priority for HIV prevention and testing. I mean, I thought they were anyway. We're ahead of the game, Jess, yet again.
Apparently so. They're just stealing our ideas.
I think that's what they did.
Yeah.
So they say it's essential we maintain our focus on combination prevention and testing levels, including opt-out testing in high and very high prevalence areas, and that has got to rapidly increase, they say. So the National Health Service England and NHS Improvement will expand opt-out testing in emergency departments in the highest prevalence local authority areas. A proven, effective way to identify new cases, and they'll invest £20 million over the next 3 years to support this activity. I am very much on board with that because I think it's an excellent way to, well, no, I'm fully on board with it. I think it's a great way to test people in a clinical environment.
That is a good lot of money being spent on it as well.
Do you know what? It sounds like a lot, but I think in the grand scheme of things, and we will look at the kind of money that's been put towards all of this and how that compares to a few years ago.
Right.
They've also said we need to make up lost ground due to the impact of the COVID-19 pandemic.
I mean, that is true. That has had a big effect.
It has. And they also say, and this is a good point, actually, that as new infections reduce, they become harder to find. I hadn't even thought of that.
Yes, they do, don't they?
How do you know when you've tested the last person?
And how do you know? Well, but how do you know at all? Because how do you know people are telling the truth? How do you know? Because there are so many different ways to test, which is fantastic. But with all those different ways to test, it's like if someone would say to me, yeah, I've tested before I tested at home. How do we know? How do we know? You could just say, yeah, I tested.
No. I mean, yes, it would be harder to find people, wouldn't it? It'd be like looking for a needle in a haystack in the end.
Yeah.
But how do you know when you've finished?
Surely you can never know that point. You could never rely on that just to go, yeah, I think we've done it now, guys. So we're just going to pack up and go home.
Yeah, that's done. We can retire.
I don't think you could you? Because you could never guarantee that you have actually tested everyone.
No. So could you ever confidently say that you've ended transmission?
What is their benchmark of proving this?
I don't know.
I feel like this is only just dawning on me. Like, how do they say that this has been a success? What does that look like?
I suppose, well, imagine if you do get to that. And then, things kind of change, don't they? So you could think you've eradicated it, and then someone pops up who then tests positive. Oh, the poor person. Imagine being, oh no, guys, you thought you'd ended transmission, but I've just tested positive.
But also, and I know we sort of probably sound like we're really nitpicking now because we're sort of talking about like one person or two people, but you're always going to have people who are migrating, like, into the country possibly. So you might, let's say everyone's tested, but then how do you know for all the different people who come here on holiday or to stay or to live or to work that they've then tested? How do we, because if you've constantly got movement of people, how can you ever be sure that you're on top of this? Do you see what I'm saying?
I do. I absolutely do see. There are too many moving parts, really, aren't there?
There really are. I'm just really interested as to what the benchmark of, what the marker is of success.
Oh, well, I'm not covering that. Who knows?
I'll wait to hear from Matt Hancock.
Yes. Where was his head at the time? He would have had a plan. He had a plan for everything.
There must have been a plan.
No, look at the way he careered through COVID.
Oh, he talked about that on the SAS Who Dares Wins, and he tried to continue to justify his actions and his behaviours by saying stuff like, but it didn't actually break the laws. It was only when it was just guidance, and I didn't do that, when he had an affair. And I was just like, just shut up, Matt. Nobody wants to hear this. Just say sorry. I don't want to hear your excuses.
Yeah, just own it.
Yeah.
Imagine still coming up with excuses all this time. I mean, he lost his job partly because of that, partly because he was awful and useless.
Yeah.
But just never been able to accept responsibility for it, which I think is part of the problem with this government. But we really don't want to go down that path because we'll be here all day.
Yeah. Well, I shouldn't have taken us off topic.
Okay, so to achieve the ambitions that we've just been talking about, there will be, and to ensure our partners across the health system and beyond maintain and intensify partnership working, there's going to be 4 core themes. There's objectives, Jess, there's ambitions, and now we've got themes. Wow. So the themes are prevent, test, treat, and retain.
What does retain mean? Are we keeping people captive?
Yes, we're going to round up everyone with HIV.
We're going to retain them.
On a barge.
Oh no!
What the government do with people? No, retainers, keep them retained in care.
Oh right, okay, that makes sense. I have never heard that expression.
Oh well, these are the core themes that we should be working to. They're going to enhance, expand, and bring together single elements of evidence-based HIV prevention activities into a comprehensive combination prevention program. If you are wondering why I sound intrigued by these ambitions, it's because I would consider our HIV charity, TVPS, who we work for, as part of this across the health system and beyond. Yes?
Yeah.
I don't think it's nice to be referred to as and beyond, but
And
never
beyond.
mind. And so I'd quite like to know how that £20 million is being distributed.
Well, yeah.
Which is what you were kind of saying earlier, where what's happening with that money. And in the grand scheme of things, it is a tiny amount. So if you look at the aid support grant, which you talked about earlier,
yeah,
it's a ring-fenced grant specifically for local authorities to fund HIV services. Arguably, some of them were very creative in how they spent it. But it was supposed to be for organisations like us and specialised social workers and all that kind of stuff. So in 2014-15, which was the last time the grant was distributed, it was £36.2 million.
Oh, wow. Okay.
So if you take into account inflation, it's a lot more money than the £20 million that they're distributing now.
But how is it being spent? Do we know that? Do we know where any of it's going? Don't they have reports like Companies House or something? Can we not go and get their accounts or something, find out where it's gone?
I don't know. I don't know how to find that out. Oh, I haven't really looked at it, to be honest. I've looked at the report. I've not looked at the kind of specifics of, okay, well, what have you done with that £20 million, government? Where did that money go?
I suppose perhaps part of it is maybe part of Health Prevention England.
I would hope so.
Health Prevention, HIV Prevention England. Be good if I actually knew what it was called, wouldn't it? It's not like this is our sector.
Imagine Oliver Brown tutting, sighing. Again, Jess, no. It's not called that, is it?
No. Yeah, so perhaps some of it's gone there.
Yeah, and some of it, I'm sure, would then have to be distributed to the kind of emergency departments or the labs.
Opt-out testing, maybe?
Yeah.
I mean, that is a great initiative, isn't it?
No, I'm fully on board with opt-out testing. I think it's a fantastic initiative. So anybody who is admitted to A&E would be screened for HIV as a matter of course, rather than being asked if they want an HIV test.
Yeah.
It happens in kind of maternity services. So any pregnant woman is automatically screened for HIV. And it works. We had a service user a few weeks ago who's pregnant, and she found out because she was screened during pregnancy that she's positive. It's sad, isn't it, that we have to kind of go to these lengths to make these things happen. It should just be standard practice, I think. But
yeah, it would be great if it was standard practice. It's a difficult one, services are stretched so much as it is. So I'm sure when the sort of new hospitals are looking at starting opt-out testing, they're a bit like, where do we even begin?
Yeah, and how do you get the labs on board? That's a significant increase in the number of blood samples that they are going. I know the blood samples are taken anyway, but it's another bit to add on to the testing process.
Yeah, absolutely.
So, okay, back to our plan. Ready? See, we've both learned things.
I really have.
This is good.
We're retaining people in care.
Yes. All good plans include objectives, and these objectives are also included in the plan. I mean, it's quite wordy, if I'm honest.
Yeah. And
if you trawl through it, oh gosh, you'll be there forever. But we will attach a link so anyone can go and read it for themselves. So by 2025, this is the progress that they want made. 2020, that's just over a year.
Yeah.
Do you know what? There are no flies on me.
Yeah.
Sean will be very proud. I mean, he sometimes, I think, doubts my financial knowledge because I tell him constantly how much I hate doing our figures. But see, Sean, quick maths mind there.
There you go, 2025, over a year away. Well done, Sarah.
Thank you very much.
So what's supposed to be happening in over a year? Okay,
so by 2025, the number of people first diagnosed in England should have dropped from 2,860 in 2019 to just under 600 in 2025.
Oh, wow, that is a massive drop.
It's quite a big drop, isn't it? We should have reduced the number of people diagnosed with AIDS within 3 months of an HIV diagnosis from 219 to under 110. And we should have reduced deaths from HIV AIDS in England from 230 in 2019 to under 115. Now, let's give some context from a local perspective. First 7 months of this year, 35 people were diagnosed with HIV at our local sexual health clinic in Slough.
Yeah.
5 a month. That is the highest number I have ever known in my 20 years at TVPS.
Yes, yeah. It was a shocking statistic when we sort of put all the stats together and we realised that's what had happened.
So I'm not sure how we locally can achieve those stats. So the first one, reducing the number of people first diagnosed, well, our diagnosis rate has massively increased. And I think you alluded to this earlier, there are too many factors. It's not as straightforward as capturing all those that need to be testing, because the goalposts keep changing. We've got movements in population. Locally, we've got increased drug use, chems use. We've got people not taking their medication. We've got people being diagnosed very, very late.
Can I also interject? We've got a cost of living crisis. How are people supposed to necessarily find the money to get to a clinic to test or get treatment? Like, we really need to think about like the wider aspects of this as well. Like, it's just not as simple as being like, yeah, brilliant, like, you know, everyone's on treatment, everything's great. Well, what if you can't afford to get to the clinic?
To get a postal test. Well, but then what if you didn't want the test to come to your home?
Well, yeah, but I'm even talking about not even just testing. I'm talking about beyond that. What about treatment? If I can't afford to get to a clinic, how am I going to stay on treatment to then be undetectable, to not pass? Do you see what I mean? Like you're saying, so many layers.
I would agree with you. And I think, you know, for me personally, I think we need a strategy for all of those challenges before we set any figures, because the same government that is setting this 2030 agenda is, like you're saying, contributing towards people not taking their medication or using drugs, because, you know, life is very tough right now.
Yeah.
So we've got more homeless people that we're supporting. We've got more people experiencing mental health issues. We've got more people unable to afford food. And we know, because it's been, you know, it's really well documented, that people living with HIV, actually not just people living with HIV, anyone living with a long-term condition will manage better if their basic needs are being met and they're not experiencing crisis after crisis.
Yeah.
And I think it definitely applies here. We're trying to, I mean, we're both fully on board with trying to achieve those aims that the government have set out. But the reality is, on the front line, is that people are struggling too much. And this is why we have more people who aren't taking their medication. Because if you can't afford to buy food and you need to take food with your medication, we've seen people say, well, I just won't take my meds because, you know, I haven't got any food in the house and I need to get to the food bank. And it's just too complex, too challenging for people at the moment.
Yeah, it's a lot. Yeah, it's just too many variables. There really are.
I think there are. I think it's very difficult, isn't it? And as we've said, because we have got more people with challenges, and we definitely have, you know, we've both worked in the organisation for a long time, and I've never known it be like this before.
No, I haven't. No. And like you said, we'd never had that many referrals ever in a month. That's crazy. Like 5 in a month. Yeah,
it's just, and all with different issues. I think the other thing is that we couldn't, like, we always look at the new referrals that are kind of sent to us and see if there are any common themes, because, you know, it's better to do preventative work to stop those themes from happening than to firefight when they happen all at once. But there aren't really, well, there are common themes in that no one's got enough money and nobody's got appropriate housing and nobody has enough food and nobody can afford to get to the clinic anyway.
Yeah.
But they're right across the board. And if you go into that, you know, the other challenges around perhaps immigration, for example, or you're in a lot of debt, or you're on a 0 hours contract and you're just not making enough money to meet your rent each month. I feel this would be achievable if we weren't living in these times.
Yes, yeah. No, well, yeah, I still think it'd be difficult, if I'm honest, for lots of the things we talked about. But yes, I think this sort of adds another layer of it being, making it extremely challenging.
Yeah. And I think, like you said, with migration as well, so we've talked about movements in population, and across Berkshire, we've seen quite significant movement. And again, that adds to the challenge, doesn't it?
Yeah, absolutely. Absolutely. How do you keep track of people? And I just, again, what are the measures of success? What are they? Because I just don't know how you'd say, yeah, we've achieved. Don't get me wrong. Like, it's good to have a goal. It's great to have a goal. So I'm not saying that we shouldn't have that goal, but like you're saying, it all seems very like, but how are we going to get there? Because it just seems a bit like, what?
I feel like they'll announce next year or the year after how the country has done in reaching those goals and getting to under 600. I feel like 559 of those people will be Berkshire. That seems to be the way we're going.
Yeah,
and everyone else will be like, oh, bravo, we've definitely reduced the number of people diagnosed. And you will be like, oh, no.
Well, like you're saying, our trends seem to be going the other way.
It's weird. And I haven't looked at other areas of the country. I feel like we've said this before, we always feel like we're travelling on a separate path to everybody else, which is concerning, isn't it?
I think absolutely. And I think this is why you definitely wanted to do this episode and talk about this, because of that fact of going, are we alone in feeling like this, that we're maybe not quite getting there, that our direction is different? I think sometimes, and this is going to be controversial, I think we all just smile, or sometimes I feel like in the sector, it's just a lot of smiling and nodding and everyone agreeing and going, yeah, everything's brilliant. We're all going towards 2030. And you're like, but are we? Are we being honest? Are we having honest conversations? I don't know. Sometimes I feel like we're not having particularly honest conversations, and we're all just supposed to smile and nod and say, yes, everything's going great.
Very true, though. And we've found this before, haven't we, with Thames use, for example, where we are seeing more and more men who are using drugs, using crystal meth than ever before. And there's no money to do any prevention work around that. And substance misuse services are already kind of busy and aren't always equipped to support those people anyway, because as we talked about before, it's linked to sex. But again, you don't really see that being reflected across the country because maybe nobody talks about it.
I don't think they do. I think perhaps there are other charities sat in similar situations as much. But again, you don't want to be that one person that puts your head above the parapet and goes, I don't think it's going that well, and everyone just shouts you down. You don't want to be that one, do you? But maybe we could start a trend and start a conversation of saying, I don't think we're going to get there. It's not because we don't want to, but I don't think we are.
That's very true. Yeah, no one wants to be the first, do they? Go, no, we're
well, exactly. Why haven't we? And actually, if we didn't have this podcast, Jimbo's joining. I'm so sorry about that.
He's very annoyed about all of this,
isn't he? I'm just going to keep going. I think if we didn't have this podcast, we wouldn't be openly talking about this.
No, we wouldn't, actually. No, absolutely not. No one's going to go to any kind of HIV meeting with all the key stakeholders from around the country and go, none of this is for us. We're not, Exactly. Or
maybe have comments or criticise perhaps some of the directions that have been taken. I mean, you're not going to do that, are you? You're just going to go, yeah, everything's brilliant, thanks, bye. Let's be honest.
Right, the second, what were they that came up with? Objectives is around reducing the number of people diagnosed with AIDS within 3 months of an HIV diagnosis, which I find, again, this is an interesting one. That's really achievable. It's just about diagnosing someone and getting them onto their meds. But I wonder where that leaves people who don't take their medication. And we have quite a few of these people at the moment.
Yep.
We had a service user recently that does not want to take their HIV medication. They've been sporadically taking it for years. And they ended up in hospital, unsurprisingly, with an AIDS-defining illness. They're much better now, but they spent a long, long time in hospital. And they are not the only person that we have. We have people that are open with us about not taking their medication. And there are lots of reasons, aren't there, why people don't. I know it's easy to think, to be judgmental and think, well, why not? The medication's there and it's free.
Yeah. No, but like you're saying, there are loads and loads and loads of different reasons. I think it's actually a really huge issue. And like you said, I think we're probably seeing more than we've ever seen people who don't want to take their medication I just think, like you're saying, I think that is a massive one to unpick that I don't think we should start to do on this episode because we'd be here forever. But like you're saying, all sorts of different people, different walks of life, just choosing this. We cannot force people to do that, For
some people, they don't want to take them because of their religious beliefs, for example, and they believe that they can be cured in another way. So you're almost facing an impossible task in persuading someone because you're questioning their faith, which I think, and again, we can do an episode specifically on this probably later down the line because it is a big subject. But we also have to be, we have to respect that sometimes people just don't want to do what we believe is right for them, but they're an adult. They've got full capacity to make those decisions.
I mean, we've had people recently almost die, come out of hospital, start back on meds, and then months go by and it's noticeable they're missing clinic appointments, they're not wanting to attend, and they're lying about it and saying to other people, oh yeah, everything's great and everything's fine, I'm taking my meds. What do you do at that point if someone's not scared enough? Because do you know what I mean, like their health deteriorated that much? It's a really big, like you're saying, this is like another issue where it's like we should be concentrating on this and trying to find a way, like you're saying, these people are adults, but how can we move forward? How will we hit 2030? You can't just wave a magic wand and say everyone's going to feel this way and everyone's going to want to take their meds, because like you've just said, not everyone feels that way. Not everyone wants to take their meds.
No, exactly. And I think this kind of report or this strategy doesn't really take into account all those little pockets of people that we've just been talking about. And they're small numbers, don't get me wrong, not massive numbers of people.
Yeah.
They are small numbers, but they are also the ones that are most likely to pass it on. And they are not alluded to in this report at all, or this strategy, whatever you want to call it.
Well, no, it's just like, these are the things we're going to do.
Like top level, isn't it? Top level. Yeah. These are the things that we should all be doing. And this, I think, is where we find it challenging, because we're like, well, what about this person over here and that person there and these three people here? It's just different, isn't it? It's just tailed off at the end. It's like giving up, isn't it?
Well, no, because I feel the same. It's all very well. I could write a report that says, right, so this is what we're going to do for HIV and Boxer. It doesn't mean it will actually happen, just writing something down.
I mean, the third point about HIV deaths, isn't it sad? No one should die of HIV or an AIDS-defining illness in this country in this day and age.
Absolutely.
To be talking about getting those numbers down is just, that's sad. Right. The government do tell us how we are going to achieve these, though, Jess. Take note.
Right. I'm ready for it.
So they said, we will keep doing what we know works.
What's that? Have they listed what that actually is? Oh, my God. That's ridiculous.
The progress we've made has required focus, effort and investment across the health system and beyond. Now, we're in that beyond bit. Not had any funding invested in us, have we?
It's very Buzz Lightyear, isn't it?
Yes, it really is. So they said, to maintain this, we cannot take our foot off the pedal or change track. We have to redouble our efforts to make up ground lost during COVID-19. Redouble our efforts.
But doing what again? What are the tangible things that they're doing?
Do you know what came to mind for me? Sexual health clinics. I mean, they redoubled their efforts years ago and throughout COVID. I just think that's insulting. We're not working hard enough. I want everyone to work twice as hard to achieve the objectives that are unachievable, because the HIV landscape is not how they see it.
This is ridiculous. Absolutely ridiculous.
I just feel it's rude, isn't it? It's like, guys, I know you've had funding cuts and I know you've got a lack of resource. And I know you've got an increase in service users, but can you just all redouble your efforts?
Do more.
Because you are way below par at the moment.
Yeah, it's bad, isn't it?
Oh, I feel valued now. Yeah. Right. They also want us to expand, improve, tailor and innovate. Anything that's got innovate in it, I switch off.
Okay.
So overused. So to ensure we reach everyone at risk of acquiring and transmitting HIV and deliver effective combination prevention, including testing, treatment and care, that's what we've got to do. Expand, improve, tailor and innovate. We're just not doing enough of it, Jess.
There's not enough of that happening.
And as our numbers decrease, obviously ours are increasing, so we've got that extra mountain to climb. But as numbers decrease, we will need to keep redefining our approach to find and support the people who need it. Who knew?
But they haven't even said what works. I'm going to go back to that beginning bit where they still haven't told us like what their secret formula of what works so well.
Oh, no, they haven't. But it requires focus, effort and investment, Jess. So across the health system and beyond. So look, we're at the end of this episode because I can't take any more. I'm bloody livid. We're going to look at the plan's objectives in more details next week, and we will give I feel like we've given our views already. We'll give more of our views.
We will just have more shocked expressions and just words of disbelief again.
Yes, but we will do it in a way that is obviously innovative, tailored, expanded and improved.
I can't wait. I want you to at the end of next episode, let's go through them and tick off whether we managed to achieve those goals.
Oh, I can tell you now, right? No, none of them. We'll have been kicked out. We won't be part of the health system and beyond.
Oh God, what, by next week do you think they'll hear this? Oh gosh, get them out of here.
The government's going to target us and say you're not included in any of this, mocking us.
Oh my goodness. Okay, well, I mean, I'm actually going to go away and try and have a little bit of a look into where some of that 20 million went.
That would be very interesting, actually. Yes, because I don't know. I was all about the kind of words and not about the finances. Oh, so yeah. That would be very interesting. And we are coming back to this next week, and we will come back to this in future. It's important for us. It's the only framework we've got.
Yeah.
So we need to kind of know it off by heart. I just think there's nothing more demoralising, is there, than knowing what you're supposed to be achieving and then finding that on a day-to-day basis, you're just never going to achieve it on your own.
Yeah, it's just not going to happen. And everyone else is sailing along going, yeah, we're doing so good, everyone. Woo. And you're like, oh, are we? Is it? Oh, we're not included in that.
Yeah, but there may be, I mean, to be fair to us, we have higher HIV prevalence in Slough and Reading than a lot of the London boroughs and most of the cities in England.
Yeah, most major UK cities, don't we?
And our populations are much smaller. And I don't know, we always get asked, don't we, why is that? Why do you have high prevalence? I don't know. We knew.
It's such a massive question. Do you know what? I'm actually dreading World AIDS Day coming up again this year. Not literally dreading it for the day that it is, because I love it. Love the awareness raising. But I mean, it should be every day. But it's more because when we get asked for press interviews, that is always the question. So why is prevalence so high? And I always just say, that is a massive question that I am not going to be able to answer for you in the 30 seconds that you'd like me to. If we knew the answer to that, right, then we would be on track for 2030. It is a huge question that's just much more complicated than just going, it's because of this. And I think we'd be really naive if we did just have some sort of stock answer.
I feel all we've done is moan about the fact we can't achieve this, and now we're telling everybody that we don't know why prevalence is so high around here.
We do work really hard, by the way. We should say that.
People listening to this going, well, you're just not doing your jobs well enough, are you?
We are doing our jobs very well, let me tell you.
Let me reassure anybody listening that wants to fund us to do work. We are redoubling our efforts as per the government guidance within our remit of being in the beyond sector of the health sector and beyond. So never fear, everyone. We are working our hardest.
Yeah, we're on it. We're on it. Like, don't worry. But no, on a serious note, we do work really, really hard. We just wanted to be honest about this whole 2030 goal. You know, it's like Sarah was saying, there have been so many funding cuts in our sector, and we all work so hard. All of the charities do. We know that. All of the sexual health clinics. And like you're saying, all of the positive people who are constantly engaging in services and taking their meds. But it's just still not going to be some magic formula that just makes it happen.
No, this is why you need local strategies, because, you know, different areas of the country are different in terms of the population they serve, obviously, but also in terms of the challenges they face it. So having an overall strategy, it should then be brought down to local level, I feel, made more specific to us. There should be roundtable discussions about what the challenges we're facing and how they compare to other kind of key HIV stakeholders in our area. None of that is happening at the moment. And so I think it's quite difficult to try and achieve a national government initiative without local support.
Completely agree with you. And I think it's important that we covered this topic. We talk about it a lot, but like we've said before, what does it actually mean?
So there you go. That's the first bit of kind of what we're talking about, what the government's talking about. Okay,
wonderful. Well, hopefully our sound will be all fixed and sorted out from next week, and we won't have one of my dogs barking in the background. We've avoided
Which one is it? Is this Jimbo?
Jimbo, yeah.
I just don't think he likes my voice. Thanks for listening to the HIV podcast. If you enjoyed our podcast, please like, rate and subscribe wherever you listen to your podcasts.
You can now also follow us on Instagram and TikTok at the HIV Podcast for behind the scenes insights and video. The HIV Podcast is produced by Thames Valley Positive Support.